35-year-old female. Am I a suitable candidate for blepharoplasty? The appearance of my eyelids was always rather full. In recent years, I'm experiencing strong fluid retention during sleep that is increasingly uncomfortable. Example, pressure on eyeballs, and a lot of extra skin, which leaves my eyes looking tired and unfriendly. Would I be a suitable candidate for blepharoplasty? And if yes, would the removal of excess fat prevent future fluid retention? Please advise suitable technique and whether or not other causes for these symptoms should be considered.
Thank you for your question. The age of 35, you are describing a history that where you're having some swelling issues in terms of swelling around the eyes and a feeling of pressure that is constant and chronic. So I want to, before discussing the surgical options to improve the appearance of your eyes, I want to mention a little bit about diagnosing what's going on. Reality is it's unusual for someone to have significant enough swelling around the eyes that they develop a real pressure feeling. So as an oculofacial plastic surgeon, someone with a original training first in ophthalmology before specialty training in plastic surgeries of the eyes, face, and then body, I want to just bring to your attention a condition called thyroid-immune orbitopathy, or TRIO, or traditionally referred to as Graves' disease. Now, I'm not saying that the symptoms you have automatically means you have Graves' disease, but there are many people whose first symptoms of thyroid eye disease is swelling and congestion and variability. You know, their eyes swell. Sometimes they have trouble with double vision, and for some people it happens very, very slowly, and so they don't realize something is not right about their eyes. So what I would recommend you do first is see a medical doctor, see an endocrinologist, see an eye doctor, an ophthalmologist, and maybe even consider getting some imaging studies based on your doctor's evaluations so that you can rule out this as a cause for your symptoms. Other things that can cause this type of these symptoms include sinus problems and allergies. So certainly seeing an ear, nose, throat doctor can also help you at least manage the swelling issues. You see, when you do cosmetic surgery, you're dealing with the tissues in a very specific way, but you are not treating an underlying problem. So if you have a systemic issue, managing that can only make any cosmetic procedure that much better. So again, let's rule out thyroid eye disease. If we reach a point where there's all that's been ruled out, everything is clear, and essentially you just have some swelling that's maybe related to some allergies or sinus issues that can be managed, then from the photos you submitted, I think it's worthwhile considering upper eyelid blepharoplasty and lower eyelid blepharoplasty. Essentially, upper eyelid blepharoplasty is a procedure where excess skin over the eyelid or fullness of the skin as soft tissue and fat is sculpted and reduced so that the eyes appear more open, more awake. For the lower eyelids, it's typically the reduction and reorientation of fat pockets so that you don't look puffy. And in some cases, the reduction of skin and the tightening of the support. Now, instead of getting into the deep details of these procedures, I'm going to suggest to you that you do a little research before you choose a doctor to do your eyelid surgery when you're ready for it. And the reason is this: as a specialist, I get to see a good number of patients who are not exactly happy with their eyelid surgery done elsewhere. And there has been, in 20 years of doing this, I learned that there is sometimes an oversimplification of eyelid surgery. People say they had their face done, their nose done, and their eyes. And although many doctors are capable of doing a good eyelid procedure, I would say a smaller group is able to do a great eyelid procedure. And so the artistry and the subtlety of how the skin is, the patterns are drawn, and the plan and the execution of these procedures there's a lot more to it. So just to be aware that one size doesn't fit all, and it's not a generic procedure. So when you're ready, I would suggest that you do just learn a little bit more about your options. So again, rule out any thyroid-related issues and then do some research to pick the right specialist to help you with the appearance of your eyes. I hope that was helpful, and thank you for your question.